An unfunded mandate is when the state government passes a law that requires a city or a county to implement a new service or a new project or just something new that they have to do that's going to cost them money, but there's no money appropriated with it. I'll give you an excellent example of an unfunded mandate. In 2019, the legislature passed the First Responders Health and Safety Act, which would provide cancer coverage for any first responder, including volunteer firemen, that have at least 10 years of service. The municipal leaders are not at all opposed to providing protection and insurance for those folks that risk their life on a daily basis, but there was no funding with this measure, so that is a huge unfunded mandate. It has to be implemented by now, January 2023, but there's no state funding to go with that, which means the local governments will have to decide how they're going to pay for that coverage. Now, what we've been asking for, and we did ask for this session, was for some consideration for some state funding to help offset that mandate. And because of COVID, and we certainly understood the impacts of COVID on the state budget, no funding was appropriated, but we were able to get the implementation date pushed out another year to give us more time for that. And I think our legislature is willing to work with us. But that is an example of a good program, a needed program, but it was passed as a requirement at the local level with no funding. So that's, we are obviously opposed to unfunded mandates.
Now more than ever, the legislature should refrain from providing unfunded mandates to cities and towns. Of course, we're dealing from the lasting effects of COVID, and we don't know when this will go away. We're dealing with revenue shortfalls. We're dealing with infrastructure woes. And so what we don't need to exacerbate the issue right now are unfunded mandates. And so an unfunded mandate right now that we've been dealing with is a mandate that's coming down with our fire department and making sure we require, and cities and towns are required to get additional insurance. And we love our first responders. I support our first responders, but requiring cities and towns to get an additional insurance on top of the insurance that we already provide is going to hit our coffers. And when it hits our coffers, of course, we cannot provide the municipal services at the level that we desire to provide them.
Well, one huge unfunded mandate was when DEQ changed the requirements for our wastewater treatment systems throughout the state of Mississippi. So when we had to have our permit renewed back in 2015, we could not do so because our wastewater treatment was obsolete, so we had to go in and see what we were going to do. So basically what it turned out to be was we had to have a new wastewater treatment facility in order to treat the new requirements that were mandated by DEQ. Now, we did get a loan for $40 million through DEQ, but it would have been nice if there was going to be a mandate put into place that came with some type of funding for a city, especially with 14,000, 15,000 population. We'll be paying for that $40 million for the next 15 years.
Unfunded mandates are often impractical. They may be a perceived response to a need. And states get unfunded mandates from the federal government from time to time as well. So it's not just a one-sided or one-dimensional issue. And so whether we at the local level get it from the feds or from the states, it's important, if it is a fiscal matter that's going to cost us money, that whatever is being sent down, that we have the means provided to implement what the state and federal leaders want us to do. Otherwise, again, we have to take from one segment that's already been funded, whether it's a capital project or a public service, and divert it to this new mandate. And so part of that's just a partnership and us communicating and make sure that we are considerate of what is being asked, how it's going to be applied, going back to what I talked about earlier, if a policy is sent down from above, that there's a mechanism to make sure that we can effectively implement it from an expense standpoint.
Unfunded mandates are very unfair to the small towns. We only have 190 people, and it was going to be very hard for us to accomplish some of the things that we've seen projected for us. And so we would like to see all the mandates funded.